Hello. In looking at these two specimens here of the liver, we want to compare and contrast them to highlight the differences and come up with the diagnosis. So this is a section or a slice of the liver, and we just rotate it, and you can see that it does not appear to be nodular or cirrhotic, and there is a very obvious mass here. So the first thing to do is always decide whether this is a diffuse or a localized or discrete process. And we can see that on higher magnification, the hepatic parenchyma is more or less normal here, but there is a well-defined, well-demarcated, large, fleshy mass. It is well circumscribed, but it has irregular outlines. The appearance is tan, brownish, and there are some friable areas here which indicate necrosis. In addition, over here you can see that there's some areas which are a little bit more pale, which are also probably due to necrosis. And over here, these dark, irregular, blackish areas indicate the presence of hemorrhage. So with an appearance like this, a large mass with irregular margins, there may even be a little satellite lesion here, for those of you who are wondering, and perhaps also here. This is very suggestive of a malignant tumor, and with a single mass like this in the liver, the possible primary would include hepatocellular carcinoma or even cholangiocarcinoma. And hepatocellular carcinoma is a lot more common. So that would be my number one top differential diagnosis here. Now let's move on to this second specimen. And again, you can see that this is a transverse section of the liver. And let's just quickly turn it around and have a look. Pretty much the same on both of the surfaces. So what we see here very strikingly is that there are multiple nodules present pretty much throughout the different aspects or lobes of the liver. Is this a diffuse process? It's not quite diffuse because you can still make out normal liver parenchyma here between these nodules. But what is very obvious is that all these nodules are abnormal masses or growths, and some of them, if you look carefully, have this central area of cavitation. And this we sometimes describe as umbilication because it looks like an umbilicus. And this is also due to necrosis because the tissue has died, it has outstripped its blood supply, and then it has fallen out. So this is multiple tumor masses, fairly rounded, fairly well circumscribed. And this is a classical appearance of metastatic malignancy. Common causes, think about the blood supply, which organ drains to the liver, and this is of course the gut. So it is quite likely that this patient may have a primary tumor in the gut. And you think backwards again about the clinical picture, this patient may present with change in bowel habit, perhaps, or GI bleeding.